Imagine seeing vivid hallucinations, intricate patterns, maybe faces, entire landscapes unfolding, but knowing your vision is severely impaired.
Yeah, it sounds like something else entirely, maybe fiction.
Right. Or a sign of a different problem. But for quite a few people with sight loss, especially veterans, this is surprisingly real.
And what's really fascinating is that these visions, they're not typically rooted in mental health conditions.
Okay.
They're actually a hallmark of something called Charles Bonnet syndrome, or CBS.
CBS.
Exactly. So it's characterized by purely visual hallucinations. They arise specifically because of eye disease or issues somewhere in the visual pathway, completely separate from psychiatric stuff.
So not mental health related?
Not primarily, no.
Here.
And this study we're looking at suggests, well, maybe 1 in 10 visually impaired veterans might be experiencing this. That's pretty significant.
Wow, yeah. And that's exactly what we're getting into today in this deep dive. We're unpacking a really insightful UK study that looks specifically at CBS in military veterans with visual impairments.
It's based on screening and survey data from members of Blind Veterans UK.
Which is a fantastic organization supporting these individuals.
Absolutely. And, looking at this specific group, veterans, it's really important.
Why is that?
Well, visually impaired veterans might also be dealing with other things, like PTSD, anxiety, perhaps depression. And these conditions could potentially, influence how they experience or even report these visual hallucinations. It adds a layer of complexity.
Makes sense. So our mission today is pretty straightforward then. We want to dig into this study, understand how common CBS actually is among these veterans, explore the kinds of things they're seeing, and really get a handle on the impact it has on their lives.
Let's do it.
Okay, so starting with the basics, in more formal terms, what exactly is Charles Bonnet syndrome?
Okay. So the World Health Organization in the ICD-11 defines it as involving exclusively visual hallucinations.
Exclusively visual.
Yes. And they're usually temporary. The crucial bit is they are not linked to any mental or behavioral disorders.
Got it. Purely visual, linked to the visual system problem itself.
That's the key takeaway.
And what might these hallucinations actually look like? What kind of things do people see?
The range is remarkably broad, actually. You get simpler things like flashes of light, we call those photopsias, or maybe basic shapes, patterns.
Okay.
But they can also be incredibly complex. Really detailed, realistic images of people, animals, sometimes entire scenes just unfolding.
Wow, that's quite a spectrum. So what's going on in the brain? Why does someone with impaired vision start seeing things?
Well, the main theory revolves around increased excitability in the brain's visual cortex.
Okay.
So when the eyes aren't sending as many signals because of the vision loss, that's what we mean by differentiation.
Right, less input.
Exactly, less input. It seems these visual processing areas can become sort of spontaneously active. They start firing on their own, leading to these internally generated sights.
So the visual system, lacking normal input, almost starts making its own pictures.
That's a good way to put it, yeah.
Now, here's where it gets really interesting for me. The study highlighted how differently people react to these experiences.
Oh, absolutely. Some people find them deeply disturbing, frightening even,
right?
But others are more neutral about them. And some, surprisingly, might even find them positive or just, interesting. It's very personal.
Highly subjective.
Yeah.
And the study mentioned about a third experienced clinically significant CBS. What does that mean practically?
Yeah, that refers to cases where the negative impact is substantial enough that it really warrants some kind of intervention.
Okay.
So it could be causing significant distress, maybe anxiety, or the hallucinations are just interfering too much with daily life and well-being.
And it seems like a big hurdle is just getting people to talk about it.
Exactly. Awareness is still pretty low, both among patients and, frankly, sometimes among healthcare professionals, too.
Right.
And that lack of understanding, combined with a very real fear of being misdiagnosed, maybe with a mental health condition or facing stigma, it often leads people to just not mention it.
That makes total sense. So why focus specifically on military veterans for this study? What makes them particularly important here?
That's a really key question. Visually impaired veterans are an interesting group because, as we touched on, there's a higher chance of co-occurring mental health challenges, PTSD, anxiety, depression. And these could potentially interact with the distress from CBS, making things more complex for them.
So it's the vision loss plus potentially other mental health factors interacting.
Precisely. And there's also the possibility of even more underreporting in this community.
Why?
Well, veterans might be more hesitant generally to report any kind of unusual sensory experience, maybe worried it could be dismissed or, misinterpreted as purely a mental health thing, not linked to their sight loss.
And didn't the study also mention a possible link to traumatic brain injury?
Yes, it did. There have been reports of CBS developing after a TBI.
Okay.
And that's relevant because, sadly, some veterans may have experienced TBIs during their service, so that adds another potential factor.
Okay, so let's get into the study itself. How did these UK researchers actually investigate CBS in these veterans? What methods did they use?
Right, so they used a cross-sectional approach, basically a snapshot in time involving screening and then a survey.
Okay.
First, they did a retrospective screening. They looked back through the records of members at Blind Veterans UK.
Those are in their database.
Yeah, using keywords like Charles Bonnet, CBS, visions, hallucination, things like that, to flag individuals who might have mentioned these experiences before.
Got it. Searching for clues in the existing records.
Exactly. Then, after identifying potential cases that way, they moved to the prospective part.
Which was?
Contacting those individuals directly for a telephone survey using a specific questionnaire designed for CBS screening.
And who was included? What were the criteria?
The main thing was being a registered member of Blind Veterans UK with documented visual impairment.
Okay.
Defined either by specific visual acuity levels, using the Snellen chart, or having an official certificate of vision impairment.
How many records did they look at initially?
They reviewed over 4,000 records. From that, they identified 461 individuals who showed potential signs of CBS based on those keywords.
Wow, 461 potential cases. Were there any exclusions? People they didn't include?
Yes. Importantly, they excluded anyone with a suspected or diagnosed neurological condition, like dementia or Alzheimer's.
Why was that important?
To try and ensure the hallucinations were more likely due to the visual impairment itself rather than another brain condition.
Makes sense. So out of those 461 people flagged, how many actually did the survey?
In the end, 115 members completed the telephone survey.
Okay, 115. What were they like? Demographics?
Average age was around 82 and a half years old, predominantly male, almost 90%, which reflects the general membership of Blind Veterans UK.
And the causes of their vision loss? Any common conditions?
Yeah, the most common underlying eye condition by far was age-related macular degeneration, AMD. That affected over half, about 58%.
Right, AMD.
And on average, these participants had severely reduced vision in both eyes. They'd also been members of the charity for quite a while, average of about 72 months, so 6 years.
Okay, so we have a clear picture of the participants. Now, the key findings. What did the study reveal about how common CBS actually is in this group?
Right, the prevalence. They found that 11.2% of these visually impaired military veterans reported experiencing CBS.
11.2%.
Yeah, with a confidence interval between 10.2% and 12.2%. So roughly 1 in 9 veterans in their sample.
1 in 9. How does that compare to, say, the general visually impaired population?
Well, interestingly, that 11.2% is actually a bit lower than estimates we often see elsewhere.
Oh.
Yeah, studies in low vision clinics sometimes report rates around 20%. Specialized retinal clinics can be even higher, sometimes way higher.
So why lower here?
The researchers suggest their figure might be an underestimate, possibly because of how they first identified cases, relying on those database keywords. Maybe not everyone's experience was recorded that way.
Yeah, it might have missed some.
Could be. It might also hint at something unique about this veteran population, maybe differences in reporting or other factors. Needs more looking into.
That's a really important point about potential underestimation. Okay, what about the types of hallucinations? Any common themes? What were they seeing?
Yes, definitely. Most common were images of people, about 67% saw those, followed by animals at 59%, and then shapes, 57%.
People, animal, shapes, what about less common ones?
Less frequent were seeing deceased people, that was about 22%. And interestingly, military-related hallucinations were reported by only 7%.
Only 7%? That's quite low, given their backgrounds.
It is rather surprising, isn't it? Makes you wonder what actually triggers the content of these visions if it's not always directly tied to personal history.
Yeah. Did most people see just one type of thing, or a mix?
Mostly a mix. The vast majority, over 83%, reported experiencing both simple types, like flashes and shapes, and the more complex ones, like people and animals.
So a combination for most. And when did these tend to happen? Any patterns in timing or location?
There were some clear patterns. They were most frequent during the daytime. That was about 77%. Also common when going to bed, around 72%.
Okay.
Less likely right when waking up. And location-wise, they were more common when the person was at home versus out and about.
Interesting. Maybe the familiar, maybe quieter home environment, less these internal things become more prominent.
That's a plausible idea, yeah. Familiar surroundings, maybe less external stimulation.
And how long had people been experiencing them? Was this mostly new or long-term?
Mostly long-term, it seems. A really big chunk, over 83%, reported having hallucinations for more than 3 years.
3 years plus.
Yeah, and that was the upper limit they asked about in the questionnaire. So for many, it's not a brief thing.
And frequency, how often?
For most, it was either at least once a day or at least once a week, so pretty regular.
Wow, daily or weekly for many. And how long did an episode typically last?
Usually brief. For the majority, around 64%, they lasted just a few minutes.
Okay, brief but frequent for many.
And importantly, most people, nearly 3/4, had actually experienced a hallucination within the week before they did the survey. So very current for them.
Okay, so for many veterans, CBS seems like a recurring long-term part of life. Let's talk impact. Were these just odd visual things, or did they negatively affect them?
Unfortunately, for many, there were negative impacts.
Yeah.
Over half described them as bothersome.
Bothersome.
Yeah. And a significant minority, 38%, found them scary.
Scary.
They also interfered with sleep for about 22% and negatively affected mood for about 26%.
And you mentioned women were more likely to report sleep disruption.
Yes, that was an interesting finding. Women in the group were more likely to say the hallucinations messed with their sleep.
Did the study look at what people were doing to cope? Any relief strategies?
Yes, they asked about that. About 58%, so just over half, had tried various strategies.
Like what?
Simple things, mostly. Like intentionally blinking, closing their eyes. Some tried to actually touch the hallucination.
Oh, interesting.
And others tried to divert their attention, focus on something else.
And did these things work? Were they helpful?
Generally not very effective, according to the participants.
Really?
Yeah, for most strategies, less than half who tried them found them helpful. The one exception was diverting attention.
Distraction,
yeah. That was reported as somewhat or very effective by almost 65% of those who tried it.
So focusing the mind elsewhere seems to be the most promising strategy they found.
It seems so, which kind of highlights the need for more research into effective coping mechanisms because the others weren't cutting it for most people.
Definitely. Okay, what about talking about it? Seeking help. Were people disclosing these experiences to doctors or family?
And this is another really crucial finding. Disclosure rates were quite low.
How low?
Less than half had discussed it with a hospital doctor. And even fewer, only 13%, with their GP, their family doctor.
Only 13% with their GP, wow.
Yeah. Disclosure was a bit more common with family, around 50%, and spouses, about 45%.
So more likely to talk to loved ones than doctors.
Seems that way. And this reluctance to talk to medical professionals is really concerning. It probably leads to underdiagnosis and people not getting the support they might need.
Absolutely underscores that barrier we talked about earlier. Fear of stigma, maybe? Lack of awareness from the doctor's side?
Likely a combination of those things.
Yeah.
And for those who did disclose, what kind of management or support did they actually get?
Right. What happened next for them?
Well, it was pretty variable and often didn't sound particularly helpful, frankly.
Oh, dear.
The most common thing was just a verbal discussion about it. Only 20% got an information leaflet.
Just 1 in 5 got a leaflet?
Yep. A tiny number got referred to a charity. Some were just told to ignore the hallucinations.
Ignore them.
Yes. And nobody reported being referred to other clinical services, like maybe mental health support if they were distressed.
That sounds inadequate. A real gap in consistent support.
It really highlights a significant gap, yeah, in understanding and managing CBS effectively within the clinical setting.
Okay. This study also tried to link specific features of the hallucinations to these negative outcomes, like being scary or bothersome, right?
Yes, they looked for associations. For scary hallucinations, they found a link with more recent onset of CBS.
So newer experiences felt scarier.
Seems that way. Also linked to how recently they'd had the last episode. Suggest maybe the novelty or unfamiliarity makes it more frightening initially.
Okay, that makes intuitive sense. What about bothersome hallucinations? What made them bothersome?
Bothersome was more linked to having had CBS for longer, over 3 years. Also linked to experiencing them more often and the episodes lasting longer.
So chronicity and frequency made them more of a nuisance.
Exactly. And those who found them bothersome were also more likely to report sleep interference and a negative impact on their mood.
Right.
And interestingly, this bothersome group was also more likely to have tried relief strategies and discussed it with doctors.
So the ones most bothered by it were the ones actively seeking solutions, even if the solutions weren't always great.
Precisely. It suggests they were more negatively impacted and therefore motivated to find help.
Okay, so let's pull all this together. What are the main takeaways from this deep dive into CBS in visually impaired military veterans?
Well, first off, it confirms CBS is definitely common in this group. That 11.2% figure, even if potentially an underestimate, is significant.
Right. It's not rare.
Not at all. And importantly, the negative impacts, feeling bothersome, feeling scary, are also frequent and clearly affect quality of life. The finding that distraction seems to be the most effective coping strategy so far is also a key point, maybe offering a direction for support.
And it seems like maybe the initial shock wears off, moving from scary to just bothersome over time for some.
That fits with a possible habituation effect, yeah. New experiences might be more alarming, while long-term CBS becomes more of a chronic, frustrating intrusion.
And the study really hammered home the reluctance to disclose.
Absolutely. Fear of stigma, maybe fear of disbelief, low awareness among healthcare professionals, especially GPs, seems to be a major barrier still.
And the clinical management side, still lacking.
Definitely. Inadequate, inconsistent. It really points to a pressing need for better education for clinicians, clearer guidelines, just better ways to support people with CBS.
Now, the researchers are good about pointing out limitations, which we should remember.
Yes, definitely. Identifying cases retrospectively using keywords might have missed people.
Right.
They didn't control specifically for the level of vision loss or the impact of any rehab people had received.
Okay.
Using charity records for info on other neurological conditions has limits too. And, the findings are from Blind Veterans UK members, so maybe not perfectly generalizable to all visually impaired veterans everywhere.
Fair points.
And they rightly said we need longitudinal studies following people over time to really understand how CBS progresses long term.
Absolutely. But despite those limitations, it feels like this study gives us really valuable insights into CBS and this important community.
Agreed.
So for you listening, what really stands out from this? For me, it's that prevalence 1 in 9 is significant. The real negative impact it has, and just how much it's still underreported and maybe not well supported medically.
Yeah, and connecting it back, when you think about how common and impactful this is, particularly in the veteran community who might already face other challenges, it really begs the question, what systemic changes are needed?
Good question.
How do we better support people having these experiences? It's not just about raising awareness, though that's huge. It's about creating environments where people feel safe to talk about it without fear of judgment.
Safe disclosure.
Exactly. And ensuring clinicians, GPs, eye specialists, mental health professionals all have the knowledge and tools to respond appropriately.
It really highlights the need for open communication about unusual sensory experiences, doesn't it? And how much awareness in the medical field matters for giving the right support, finding coping strategies that actually work.
And ultimately improving quality of life for people living with Charles Bonnet syndrome.
It's a powerful reminder that there are still many hidden experiences out there, and understanding them better is absolutely crucial.